The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it is so great to see you.
Oh, it's so good to see you, Shay.
So this summer is really flying by, is it not?
It's like warp speed. Yeah,
It
it's
really,
crazy.
it really is. Where did it go?
Um,
Today we're going to talk about something that, I know we've talked before about how the eye area seems to show age before sometimes the rest of our face does. So we're going to talk about like something you can do there, a procedure that you do there at Living Well that can assist with that.
yeah, it's actually a fan favorite, is what we call it.
All
Its
right.
term is bright eyes. Patients come in literally asking for this by name. We developed this procedure probably back in 2014-15, just after Voluma was launched and came on the market. And basically, what you're doing is you're focusing on the midface volume loss and
Mhm.
replacing that properly. And then also that infraorbital hollowing or the tear trough is what patients come in asking for. There's a lot of information that patients get out there from TikTok and Instagram and Facebook
Right.
and Snapchat and all those things that are out there. And some of it is good, but some of it is not so good. And they come in wanting their tear troughs filled because they've seen some influencer out there talking about it, when actuality what they need is mid-face volume replacement. Over 90% of the volume deficit under the eyes can be corrected by actually correcting the volume in the cheek area.
So is
So
it just that the volume has like drooped? Has it just fallen? Is that the main cause or?
So yeah, there's a couple of reasons. One, you have the fat pads underneath here that are supporting these structures that we're losing fat as we age. And then you
I
have the
see.
relaxation of one of the major ligaments in here, which is the zygomatic cutaneous ligament, which actually lifts this tissue. And as we age, that also starts to decrease in its ability to hold the cheek up and hold the skin up. So by restoring the volume with Juvederm Volumex C, which is what we use here at Living Well, we get a beautiful result. And then we use what's called Vobella, uh,
Mhm.
Juvederm Vobella XC, which is one of the lighter fillers, to put it in terms that patients can understand. And we use that deep under the muscle, right in this area, to correct any volume deficit that might still be needed after we correct the cheek. And it's an absolute beautiful result. It lasts for about 2 to 2.5 years. There's
Wow.
minimal downtime with it, actually, because we use a cannula under the eye and we go deep under the muscle. There's actually no bruising using this procedure, except for maybe
Interesting.
where you put the needle in out here.
Uh-huh.
But I've seen a lot of infraorbital treatments where patients were pretty much, they look like raccoons when they finish. They have so much bruising. With the way we do this procedure, there's minimal downtime, minimal bruising. I never say someone won't bruise, but we definitely reduce the likelihood of bruising in that area. Very natural looking, and that's one of the things we pride ourselves here at Living Well, is we want our patients to look natural. We want them to look refreshed. We want them to look rejuvenated, but we never want them to look done. We want the cheek to have a natural contour with a nice lateral lift, and we want the infraorbital hollow, to what we call the lid cheek junction, to be smooth and corrected, so that the transitions are gentle to the eye. So our patients love this. Again, there's minimal downtime to it. There's minimal discomfort to it. It takes probably about 15 minutes to do this procedure when they come in to see me or Ben. And both Ben and I are both, we perform that here at Living Well. So, it's just, again, it's a fan favorite. People come in once they get it done. They come back every 2, 3 years and ask for it by name. And the results are amazing.
All right, I have one last question for you.
Yeah.
Inquiring minds want to know pain level on a scale from 1 to 10. What would you say?
So the cheeks, I would say 1 to 2. The infraorbital hollow treatment, that portion of it, maybe a 3.
Oh, not bad
It's
then.
it's very temporary. Literally, this part of the treatment takes me less than about 10 seconds to do.
Okay. I think
So,
anybody could handle that, right?
yeah. Yeah, it's very quick, very easy. Our patients who have gotten it over and over, they rate it again between a 2 and a 3.
Awesome. All right. Dr. Chapman, thank you so much for coming on and sharing this information.
Oh, thank you for having me, Shay. So good to see you.
You as well.